Hi, hello. I'm Dr. Manoj from Specialist Orthopedic Surgeon from Aster Clinic Butina. So I also work part-time in Aster Clinic in Ajman as well as in the nearby Aster Hospital. So most of the cases that I get in and around the Butina is actually, as with any other orthopedic department anywhere, is mostly involves pain of the neck and upper back, then again coming to the lower back and radiating to the legs. So the most common cause of such a common occurrence of these symptoms is because of the long travel undertaken by most of the residents in and around Butina to Dubai for their work. Not the distance, but actually the amount of time they spend sitting in the car or in the transportation, which accounts for the now increase of the stresses that they place on the spines and the disc. So we have so apart from the medical treatment given, of course, we have a very good in-house physiotherapy department there, and that caters to the rehabilitative part of the work. So apart from the back pains and the neck pains that are very common, the other category of patients that usually come involve hand injuries, because we have got a lot of industrial areas around. Hand injuries are quite a common occurrence. They come in the form of crush injuries with dislocations, with fractures. So we have a dedicated local table there to take care of the local anesthetic part. Then a lot of pediatric cases also come in, because pediatrics is one of the specialties in which I'm interested in. It involves a lot of deformities, pediatric deformities like congenital talipes equinovarus, the corrective plastering part we do in the clinic itself, including the percutaneous tendoculus stenotomies, which are usually part of the procedure. And then for more complicated procedures like post-traumatic release and things like that, we take them to the hospital. Then we also get a lot of coronal plane deformities of the knees, the genu varum and the genu valgum, because most of the parents are quite worried about the child walking abnormally, as many of the relatives point out. So most of them need just observation and close follow-up. And few of them may need bracing. We have a very good in-house orthotic system where we brace the patients also. And a very minority of them may need surgeries, for which we take them to the hospital. So this is the sum total of the cases, the kind of cases that we see there, and the scope of service provided by the clinic. So in Aster, as we always say, we care.